Hi friends, Dr. Cyril here. Let's have a small talk on mental health today. Let's start with asking ourselves, are we healthy? So the World Health Organization says health is a state of complete well-being, but of physical, mental and social all put together. So of significance here is it's not just a physical aspect. The mental and the social well-being also forms an important component of your health. So now let's see what Ayurveda says about health. It says, Samadosha samagnischa samadhatu malakriya prasannatmendriya mana swasthaiti abhidhiyate. So the first sentence, the first line of this is talking about the anatomy and the physiology of a human body. And mind you, the second line, the first three words, they talk about the soul, the sense organs and the mind. All put together is what is called as swasth or health. So now you've got to know by now what I'm trying to say here is no one is healthy unless his or her mind is healthy. So let's talk about the unhealthy mind first. The disorders that make the mind unhealthy can be categorized broadly into two groups, group 1 and group 2. Group 1 illnesses are purely from the mind perspective. Okay, and so they are called the psychiatric illnesses. These include anxiety, depression, Alzheimer's, bipolar, ADHD, schizophrenia, etc., etc., etc. And these psychiatric illnesses, they are hugely unreported due to the stigma that the society carries along with it. So people do not want themselves to be known to have these mental disorders. So statistically, the reported cases show that 32% of Indians suffer from depression and some of the other anxiety disorders. But on a factual note, almost 85% and more of the whole global population suffers from one or the other anxiety problems or a depression. Now the second group is a bit interesting one. So these illnesses, they're called the psychosomatic illnesses, which mean they have two components. The psycho, the mental component, as well as the soma, that is the bodies or the organs of the body component. So it means that these are the disorders which are psychological in origin, but they are manifested through various physical symptoms. And the interesting part is, most often these physical symptoms, they do not have any medical explanation. So let's see how and what these are in the next couple of slides. One best example is having anxiety for no reason, and you do not have some related underlying condition for that anxiety. More commonly seen psychosomatic illnesses are related to increased blood pressure. So there's no reason for your blood pressure to increase. You just feel uneasy and your blood pressure, when you see it, is increased. Sleeplessness, the most often seen psychosomatic disorder. There's no cause for not having a sleep. Another one on the rise is pain which is unexplained. So you have chest pain, you go to a doctor, you see your ECG is normal, your stress test is normal. You have inflammatory pain of your joints and your muscles, but then there is no cause to it. The worrying part is with the urbanization and the globalization, both the psychiatric as well as the psychosomatic, both type of illnesses are on rise. So the causes could be varied, but more so after the pandemic, the symptoms have been seen across a large number of populations, and the psychosomatic components have grossly increased. Now we reach the crux of the discussion of today. We are not having just this problem that we discussed, not that one problem. We have two problems in hand. The first problem is these psychiatric as well as psychosomatic conditions have increased. The second problem is with the treatment available for these conditions. We have three issues. One is the side effects, they are spoiling the quality of life of the patients. Second, not all the patients benefit from the available therapies. And the third thing is there is gross dependence on the treatment that is available for these conditions. The leading side effects of these so-called anxiolytics and antidepressant medications is indigestion, diarrhea, and constipation. Then the general symptoms of drowsiness are fatigue and as well tremors. Second problem with the available therapies that not all patients benefit from these stems primarily from the logic that every single person has different contributory reasons for his mental condition. If there is no customized approach to the treatment of that particular patient, you will not have all the patients benefit from that single therapy. And one more contributor to that is the reductionist approach. Unless and until you are not able to see the holistic disease, there is no wonder that all patients benefit out of it. You cannot have one contributory reason for one particular symptom. So, due to the reductionist approach, not every patient will be in a position to benefit with the current therapies. What actually is needed is an integrative approach. So you need the neuroscientific study-backed holistic means of therapy for patients suffering from mental illnesses. As far as my knowledge goes, Ayurveda integrated with metacognitive behavioral therapy along with yoga and meditation is a perfect combination to battle mental illnesses. Ayurveda will be ensuring the holistic approach of the scientific mind and body healing techniques along with the behavioral correctional therapies by the metacognitive ones and yoga and meditation to ensure that the spiritual aspect of the person is taken care of. The Mind Clinic at GPHC provides a detox for the mind along with a rejuvenation therapy. Now that includes an in-house regime of either a 7 or a 15-day treatment. That includes Sattva-Vajaya Chikitsa, correction of the gut microbiome, which obviously is intended to work with the gut-brain axis. Then implementation of an Ayurvedic diet, and this is infused with eye yoga, that is integrated yoga, along with meditation. The principles of Ayurveda believe strongly in etiopathogenesis of something called as ARM, which is the originator for any disturbed internal homeostasis. Now the intention of getting a cure and not just remission is to remove this arm from your body. Now you call this arm as the toxins, the molecules which are not good, the harmful elements. You have to remove this, and there is a specific way to remove that, and that is called the panchakarma, which is what detox means. And GPHC's Mind Clinic applies these panchakarma techniques for removing all the accumulated toxins due to your lifestyle, due to your diet, and due to your occupational related issues. which ensures that the arm gets out of your body and you get a new normal. So the eye yoga encompasses the yoga aspect right from the yam, niyam and the asana. Then there is infusion of the dinacharya and the ritucharya as per the Ayurveda concepts, which will take care of your homeostatic relationship with your internal and external ecosystems. Then there are discourses. These discourses cater to cognitive neuroscience, application of emotional intelligence, and positive psychology. All of this put together creates you for increasing the threshold of pain, managing coping strategies much better, and making yourself much more mentally immune. So to summarize, mental health problems are on the rise. We need to work holistically towards ensuring there is a cure and not just a temporary fix to mental health issues. And most importantly, having a holistic approach towards being healthy, both physically, mentally, and to top on that, behaviorally, which ensures that your sociological health is also great. Your dinacharya, your ritacharya, your basic lifestyle, and your ahar and vihar, that needs to be corrected. With the current globalization, urbanization, and the complexes related to it, I strongly suggest that we visit the roots of ancient wisdom and ensure that we utilize those time-tested techniques for getting back to a new normal. I thank you for your time and your patient listening to my discussion. Thank you.